Lipid emulsion. Lipid emulsion or fat emulsion refers to an emulsion of lipid for human intravenous use, especially catering critically ill patients that cannot consume food and administer their required nutrients enterally. It is often referred to by the brand name of the most commonly used version, Intralipid, which is an emulsion of soybean oil, egg phospholipids, and glycerin, and is available in 10%, 20%, and 30% concentrations. The 30% concentration is not approved for direct intravenous infusion, but should be mixed with amino acids and dextrose as part of a total nutrient admixture. Medical uses. Nutrition. Intralipid and other balanced lipid emulsions provide essential fatty acids, linoleic acid LAO, and oleaminous 6 fatty acid, alpha-linolenic acid ALA, and oleaminous 3 fatty acid. The emulsion is used as a component of intravenous nutrition for people who are unable to get nutrition via an oral diet. These nutrients are combined with the intention of administering parenteral nutrition, where nutrients are delivered in an alternative pathway. Other local anaesthetic toxicity. Lipid emulsions are effective in treating experimental models of severe cardiotoxicity from intravenous overdose of local anaesthetic drugs, such as bupivacaine. They have been effective in people unresponsive to the usual resuscitation methods. They have subsequently been used off-label in the treatment of overdose from other fat-soluble medications. Vehicle for other medications. Propofol is dissolved in a lipid emulsion for intravenous use. Sometimes etomidate. The vehicle for etomidate is propylene glycol is supplied using a lipid emulsion as a vehicle. The possibility of lipid emulsions as an alternative drug delivery medium is under works. History. Intravenous lipid emulsions have been used experimentally since at least the 19th century. An early product marketed in 1957 under the name Lipimol was briefly used in the United States, but was subsequently withdrawn due to side effects. Intralipid was invented by the Swedish physician and nutrition researcher Arvid Retland, and was approved for clinical use in Sweden in 1962. In the United States, the Food and Drug Administration initially declined to approve the product due to prior experience with another fat emulsion. It was approved in the United States in 1972. Research. Intralipid is also widely used in optical experiments to simulate the scattering properties of biological tissues. Solutions of appropriate concentrations of intralipid can be prepared that closely mimic the response of human or animal tissue to light at wavelengths in the red and infrared ranges where tissue is highly scattering but has a cardioprotective agent. Intralipid is currently being studied for its potential use as a cardioprotective agent, specifically as a treatment for ischemic reperfusion injury. The rapid return of myocardial blood supply is critical in order to save the ischemic heart, but it also has the potential to create injury due to oxidative damage via reactive oxygen species and calcium overload. Myocardial damage with the resumption of blood flow after an ischemic event is termed reperfusion injury. The mitochondrial permeability transition pore MPTP is normally closed during ischemia, but calcium overload and increased reactive oxygen species ROS with reperfusion open MPTP, allowing hydrogen ions to flow from the mitochondrial matrix into the cytosol. The hydrogen flux disrupts the mitochondrial membrane potential and results in mitochondrial swelling, outer membrane rupture, and the release of pro-apoptotic factors. These changes impair mitochondrial energy production and drive cardiac myocyte apoptosis. Intralipid 5 ml/kg provided 5 minutes before reperfusion delays the opening of MPTP in vivo rat models, making it a potential cardioprotective agent. Liu et al. 2014 found that the cardioprotection aspect of intralipid is initiated by the accumulation of acylcarnitines in the mitochondria and involves inhibition of the electron transfer. The mitochondrial accumulation of acylcarnitines, primarily palmitoyl carnitine, inhibits the electron transport chain at complex Roman 4 generating protective ROS. The effects of ROS are both site and time sensitive, meaning that both will ultimately determine whether the ROS are beneficial or detrimental. The generated ROS, which are formed from electrons leaking from the electron transport chain of the mitochondria, first act directly on MPTP to limit opening. ROS then activate signaling pathways that act on the mitochondria to decrease MPTP opening and mediate protection. Activation of the risk pathway by ROS increases the phosphorylation of other pathways, such as phosphatidylinositol 3 kinase/ACT and extracellular regulated kinase ERK pathways, both of which are found in pools localized at the mitochondria. The ACT and ERK pathways converge to alter glycogen synthase kinase -3 beta GSK-3 activity. Specifically, ACT and ERK phosphorylate GSK-3 inactivating the enzyme and inhibiting the opening of MPTP. The mechanism by which GSK-3 inhibits the opening of the MPTP is controversial. Ishihara et al. 2007 proposed that it is achieved through interaction of GSK-3 with ANT subunit of MPTP, inhibiting the CYP-ANT interaction, resulting in the inability of the MPTP to open. In a study by Rahman et al. 2011, intralipid-treated rat hearts were found to require more calcium to open MPTP during ischemia-reperfusion. The cardiomyocytes are therefore better able to tolerate the calcium overload and increase the threshold for opening of the MPTP with the addition of intralipid.